Hello again, this is Dr. Ethan Lee. In the second part of this video, I'm going to talk about the anatomy behind hypermobility syndrome. So it is very common for someone who has hypermobility syndrome to ask, why do I feel tightness and stiffness in my joints if they are hypermobile? Let's take a look at anatomy of our hip joints. The SI joint, the sacroiliac joint, is one of the most important joints in our body. It is the largest joint in our body. It supports the weight of our entire upper body and is responsible for proper weight distribution between your lower extremities. So, from a structural point of view, it is very important to have stability in your SI joints. So there are two structures that are contributing to the stability of our joints. First is the ligaments. There are multiple ligaments that connect the bone and joint to hold them together and keep them stable. You can see there are many ligaments up and down on the side that are holding our hip joints together. Secondly, our muscles. There are multiple layers of muscle across all of our joints. The predominant function of muscles are to produce joint movement through muscle contraction. From previous video, I did mention that another very common name for joint hypermobility syndrome is ligament laxity. That means the ligaments are too loose, which create instability in the joint. Remember, hypermobility can affect every joint in our body, but now I'm just using the SI joint as our example. I'm going to take off the superficial muscle layer on the left side of this body so we can see both structure more clearly at the same time, the ligaments and the muscles. So you see, ligaments are a deeper layer compared to our muscles. If someone's ligaments are too loose to hold the joints together, muscles will need to tighten up to prevent your joint from collapsing. And when muscles are tightened up constantly, the joint movement will be more restricted, which will result in tightness and stiffness in our back and our hips. This is also why sometimes stretching and soft tissue massage can make you feel better for a while. But then the muscle either tightens up shortly after the treatment, or your symptoms actually got worse after just a few hours.
Most structural medicine, like physical therapy, massage therapy, yoga, or regular chiropractic manipulation, focus on mobility of your joint and your soft tissue. But if you have hypermobility syndrome, mobility will be the last thing you need. So if you have poor result from any of the physical medicine I mentioned above, or if the treatment works but only lasts for a short period of time, you might have joint hypermobility syndrome. In Northwest Structural Medicine, we utilize a low-force chiropractic technique called sacro-occipital technique that differentiates between a joint that's too mobile versus a joint that's not mobile enough. For the joints that's too mobile, we focus on restoring stability of the joint, both structurally and neurologically. On top of physical treatment, nutritional supplementation is also a very crucial element when it comes to treatment of hypermobility syndrome. One of the most important things I check is the function of your adrenal gland.
Let's take a look at this chart. I saw this chart on one of Gaia Herb's article. This article has some great information about adrenal health and some herbal supplementation from Gaia Herbs. I'm sharing the link to the article at the video description section. Make sure to check it out. So, our adrenal glands have many essential functions. They produce hormones that help regulate your metabolic system, your immune system, your endocrine system, and your stress response. When we experience stress, our adrenal gland produce and regulate a stress hormone called cortisol to help us manage stress. However, even though cortisol is an important hormone that can help us manage stress, it not only downregulates our body's collagen synthesis, it also stimulates the degradation of collagen. And collagen is the most fundamental nutrition for the health of your ligament and your connective tissues. Adrenal glands function will directly affect our connective tissues integrity and its healing rate.
I find chronic adrenal fatigue a very common problem people have when they have joint hypermobility syndrome. I think that is also why most symptoms of hypermobility is related to your stress. All right, that's all for today. I want to appreciate your time and your attention, and I do hope this video is helpful for you. So if you have any more questions, please visit my website at structuralmed.com or just Google Northwest Structural Medicine at Bellevue. This is Dr. Ethan Lee, and I will see you in the next video. Bye-bye.